Hello, my name is Dr. Lisa Colton. I'd like to take a few moments to discuss with you vaccinations or shots. Shots introduce a small amount of killed or disabled material from an infectious organism into an individual to teach the immune system how to combat infection from that organism in the future. The first written record of public vaccinations was in 1000 BCE in India or China. These early vaccinations were for smallpox, which was responsible for millions of cases of the disease and hundreds of thousands of deaths per year. Things have come a long way since then in the study of vaccines and illness prevention. Aside from providing clean and safe drinking water, no other public health intervention has been as effective in decreasing illness and death in the world. The most vulnerable individuals to the diseases in question are infants, children, and those with chronic medical conditions. It's for this reason that pediatricians recommend all of the vaccinations included in the schedule published by the AAP, or American Academy of Pediatrics. In 1907, almost 1 in 5 children in the U.S. died before their 4th birthday. Currently, less than 1 in 10,000 die from the preventable diseases included in the routine vaccination schedule. While this progress is remarkable, the job is not finished. The only vaccine preventable disease that has ever been completely eradicated to date is smallpox. Anytime we let our guard down, these diseases let us know that they're still with us. An example of this is seen with measles. Measles was declared eliminated from the United States in 2000. At that time, there was an average of 60 cases per year in the U.S. Contrast that with 2013, in which there were more than 160 cases, only 25% of which were acquired in other countries. These outbreaks were in communities which did not receive the recommended vaccinations. This demonstrates the vulnerability of unvaccinated individuals to disease, especially as our borders and world travel barriers become less distinct. Vaccine success has suffered greatly in the past 2 decades from an onslaught of misinformation, myth, and outright lies which the media has helped to spread and maintain. Some of the most widely distributed of these untruths includes the belief that vaccines are developed quickly by large drug companies and released for maximum profit without regard to side effects. In fact, vaccines are created independently by scientists, and there is usually a 10 to 15-year interval before the vaccine is offered to the public. A vaccine, once developed, must be reviewed and approved by the U.S. Food and Drug Administration for further investigation before the vaccine is used or tested in human volunteers. Tens of thousands of volunteers over several more years are studied to make sure that the vaccine is safe and effective, as well as to determine the correct dose and document side effects. Only after this human clinical phase is complete is the vaccine available for general use. At that point, numerous physician and research scientist panels consider the use of the vaccine before recommendations are made for use in your child. Another erroneous belief is that vaccines are dangerous and that the side effects are not reported or followed up on. While everything has a risk, which must be weighed against the benefits, the clear benefit of disease prevention far outweighs the low but definable risks. Fever, pain, and soreness at the injection site are considered normal side effects which show that the immune system is responding to the vaccine. True allergic reactions or even life-threatening events after vaccination occur only once per every 1 million vaccines given. The CDC and the FDA maintain the Vaccine Adverse Event Reporting System, a real-time database which allows healthcare providers and parents or patients to report suspected adverse events related to a vaccine administration. Lastly, and possibly most difficult to address, is the growing popularity of redesigning the vaccine schedule to avoid concerns such as the baby receiving too many shots at once, or the possibility of overwhelming an infant's immune system. The vaccine schedule recommended by the American Academy of Pediatrics was designed to protect babies from the diseases most dangerous to them. Waiting to provide an immunization needlessly exposes an infant to diseases which could cause harm or death. Today's vaccines are used around the world to try to keep our babies as safe and healthy as possible. Decades of research in dozens of countries have provided millions of babies the opportunity to grow up and avoid the pain, scars, and sometimes permanent disabilities associated with many childhood diseases. We are pleased to be able to partner with you to continue to protect our children and our future. Thank you.